Good morning. In today's class, we are going to start with a new chapter of lectures that will be related to antibiotics. Okay, so this is a new series of lectures which we will continue for 2 to 3 weeks, and we will study about all the different types of antibiotics. So in today's class, we are first going to see a brief introduction about antibiotics, their mechanism, their overall mechanism of action, resistance of antibiotics, how to prevent antibiotic resistance, and then antibiotic prophylaxis. And in the second half, we are going to study about the first type of antibiotics, that are the beta-lactam antibiotics. So coming to the first lecture, we will first see the introduction, mechanism of action, antibiotic resistance, how to prevent the resistance, and antibiotic prophylaxis. So as you all know that antibiotics are the agents which are used to either prevent the bacterial growth or kill the bacteria. So they are basically a type of antimicrobial agents that are used either to prevent the bacteria or to kill the bacteria. But these antibiotics are not active against viruses and fungi. So if there is a viral infection or a fungal infection, antibiotics will have no role in treating such type of infection. They are only used against the bacterial infections. Now, almost all the antibiotics are derived from the microorganisms except few antibiotics which are synthetically produced. So the example of antibiotics that are synthetically produced are sulfonamides, oxazolidinones, and fluoroquinolines. So these three categories of antibiotics are produced synthetically. Now we are telling that antibiotics are used to either kill the bacteria or prevent the growth of bacteria. So how are they doing this? What is the name allotted to such type of action? So if the antibiotics are used to suppress the growth of bacteria, that means they are only preventing the growth of bacteria, such type of antibiotics are known as bacteriostatic. And if the antibiotics are used to kill the bacteria, then such type of antibiotics are known as bactericidal. So the agents which are used to suppress the growth, prevent the growth of bacteria are bacteriostatic, and the agents which are used to kill the bacteria, they are known as bactericidal. Now first coming to the bacteriostatic. Now what are these bacteriostatic agents? As I told you, these are the agents, they prevent the growth of the bacteria, but they do not necessarily kill them. So the the antibiotic plus the immune response of the body together will be responsible to remove the bacteria from the body. So the immunity of the body as well as the bacteriostatic agent together should work together, and it will help to eradicate the bacteria from the body. If the immune system is not very well developed or it is not working properly, then what will happen? As soon as the antibiotic is stopped, the bacteria will start to grow again. In the bactericidal, there is complete cell death, so there is no chance of growing again. So these antibiotics, they completely kill the bacteria. So these are the names allotted according to their mechanism of action. If their mechanism of action is only to prevent the growth, then they are known as bacteriostatic. If their mechanism of action is to kill the bacteria completely, then they are known as bactericidal. Now, bactericidal are usually considered necessary in dangerous type of infections such as endocarditis, osteomyelitis, or meningitis. So in such dangerous conditions, bactericidal action is considered very necessary. Now, bactericidal antibiotics, we are telling that they kill the bacteria. Now, how are they killing the bacteria? They are basically attacking the cell wall of the bacteria, or they are attacking the enzymes or proteins which are present in the cell membrane of the bacteria. So these antibiotics, they attack the cell wall or cell membrane of the bacteria and they rupture it. So all the contents which are present inside the bacteria, they diffuse out, ultimately leading to cell death. So this is how the bactericidal antibiotics are killing the bacteria. There are numerous examples depending upon the exact mechanism of action. For example, the drugs which are inhibiting the cell wall synthesis, they are penicillins, cephalosporins, monobactams, etc. Whereas the drugs which are inhibiting the enzyme, which are targeting the bacterial enzyme or the proteins, they are fluoroquinolones, metronidazole, cotrimoxazole, etc. So this is the basic mechanism by which the antibiotics are killing the bacteria. Now we will see what is the mechanism of bacteriostatic antibiotics. How are they able to prevent the growth of bacteria? Now such type of medications, the bacteriostatic, they basically act inside the cell. As you have seen, bactericidal, the ones which kill the bacteria, they are acting on the cell wall or the cell membrane. That is, they are acting extracytoplasmic. Whereas the bacteriostatic agents, they act intracytoplasmic. It is not necessary that they should act intracytoplasmic, but majority of the bacteriostatic agents, they act intracytoplasmic. That means inside the cell. So they act on the protein production of the bacteria, they target the DNA of the bacteria, and they also target the ribosomes of the bacteria and other metabolic processes of the bacteria. So they basically enter inside the bacteria and then they act in the cytoplasm of the bacteria. Thereby, they limit the growth of the bacteria. Examples are tetracyclines, sulfonamides, chloramphenicol, etc. As I said earlier, these bacteriostatic agents has to work. The immune system of the body has to work with these bacteriostatic agents to remove the microorganisms from the body. Now, if we club all the mechanism of action together, so what is the mechanism of action? What are the different mechanism of action of bacteriostatic and bactericidal together? So we can say that the mechanism of action of antibiotics together is, whether it is bacteriostatic or bactericidal, they act by inhibiting the cell wall synthesis, they act by altering the cell membrane integrity, that is the tightness of the cell membrane, and as I said, they act on the ribosomes, that is the protein synthesis, they act on the DNA synthesis, and they act on the folic acid synthesis. So these are the 5 broad mechanism of actions of antibiotics all together, whether they are bacteriostatic or whether they are bactericidal. So if you see in this picture, you can understand the cell wall synthesis. That means they are acting on outside the bacteria, cell wall and cell membrane. Then inside the bacteria we have nucleic acid synthesis inhibitors, The drugs which are acting on the ribosomes and inhibiting the protein synthesis, they are also acting inside. Folic acid synthesis inhibitors, they are also acting inside. So they are known as intracytoplasmic. The drugs which are acting inside the cell wall or inside the cell membrane are known to have intracytoplasmic action, whereas the drugs which are acting on the cell wall or on the cell membrane, they are known to have extracytoplasmic action. So extra and intracytoplasmic. Extracytoplasmic means they are inhibiting the cell wall and the cell membrane. Intracytoplasmic means they are acting inside the cell wall or inside the cell membrane. They are acting in the cytoplasm. So they are inhibiting the protein synthesis, they are attacking the DNA, they are attacking the folic acid synthesis of the bacteria. Now, most of the time, but it is not always, most of the time, as I said, that the agents which show extra cytoplasmic effect will be bactericidal most of the time, and the agents which show intracytoplasmic effect will be bacteriostatic. But it is not necessary it should be like that, but majority of the time it is proved to be correct. Now, some bacteriostatic means they are only inhibiting or preventing the growth of bacteria. So, if the dose of such agents is increased, if the dose of bacteriostatic agents is increased, then at high concentration they become bactericidal also. Some of the bacteriostatic drugs, if their concentrations are increased, they become bactericidal. Now there is one more classification depending upon the spectrum of activity. Spectrum of activity means how 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 many bacteria are the drugs targeting. Okay, how many bacteria are they able to kill, or how many bacteria are they able to inhibit the growth. So there are two classifications, the broad spectrum and the narrow spectrum. So from the name you can understand broad spectrum means these drugs, they are able to target a wide range of diseases. That means they are able to target a wide range of bacteria. That is why they are known as broad spectrum antibiotics. Narrow spectrum means these agents are able to kill or inhibit a very limited species of bacteria, limited number of bacteria. That is why they are known as narrow spectrum antibiotics. Now, when are these agents used? Narrow spectrum antibiotics are used when the actual bacteria which is causing the infection is known. If we know the bacteria which is causing the infection, then narrow spectrum antibiotics can be used. Only that drug can be prescribed to the patient which kills that particular bacteria. But if the bacterial infection is not known, if we do not know which bacteria is causing the infection, or if there is a chance of multiple bacterial infection, then broad spectrum antibiotics will be used. Now these broad spectrum antibiotics, although they are powerful, but they will have dangerous effects on the body's normal bacteria. Because they are broad spectrum, they target a wide range of bacterial species, so they disturb the normal bacteria of the body, and there are chances that they develop bacterial resistance also. Whereas narrow spectrum, they do not have much side effects because they are targeting only those bacteria which are unwanted, which are causing the infection, and the beneficial bacteria which is present in the body is not affected. So that is the advantage of narrow spectrum. But if we do not know which bacteria is causing the infection, then broad spectrum antibiotics are prescribed, especially in prophylaxis. When we prescribe antibiotics for prophylaxis, then we do not know which bacteria might cause infection. So in such cases, broad spectrum antibiotics are prescribed. So this is about the mechanisms, how the antibiotics are acting. Okay, where are they acting? What is the mechanism of bactericidal agents? What is the mechanism of bacteriostatic agents? What is the spectrum of activity, the broad spectrum and the narrow spectrum? And what are bacteriostatic, the basic introduction, what are bacteriostatic and what are bactericidal agents. Okay, so this all we know now. But now we will see what is causing antibiotic resistance. Now we have seen what are antibiotics, how are they acting, what is the spectrum of activity, where are they acting on the bacteria, what are they causing to the bacteria. But how is this resistance developing? Why are the bacteria becoming resistant to antibiotics? So the bacteria are becoming resistant to antibiotic because of many different reasons. The first is inappropriate indications. If the doctor are not giving proper indications to the patient, then antibiotics will be misused and resistance might develop. If the dosages are not taken properly, duration of use is not proper. So all these things develop to antibiotic resistance. Now in most of the hospitals, half of the antibiotics are prescribed to patients without seeing any signs and symptoms of infection. So most of the cases you might have also experienced, like in hospitals, if there is a normal fever and cough, the doctor starts prescribing antibiotics. Or most of the time the patients they self-medicate themselves with antibiotics. So one third of the antibiotics are prescribed empirically by experience, and other one third are given for prophylaxis, and the other one third are given appropriately by doing a blood test or a culture test and to identify which bacteria is actually causing the infection and then prescribing the antibiotics. And in the dentistry also, second to the use of painkillers, that is analgesics, antibiotics are the commonly used drugs that are prescribed by the dentist also. So these are the things which can aggravate antibiotic resistance. Now, antibiotic resistance does not mean that the body is becoming resistant. It means that the bacteria which is infecting the body, it is becoming resistant to the drug. So it develops when bacteria which is actually causing the disease, it changes in response to the use of antibiotics. So because the antibiotics are not prescribed properly, frequent taking of antibiotics or taking a subtherapeutic dose of antibiotic, that means not completing the entire dose of antibiotic. So all these things gives a chance to the bacteria to develop defensive mechanisms. So we are taking a subtherapeutic dose, we are not taking the suggested dose of the doctor, stopping the antibiotic in a half course. As soon as we feel better, we stop the antibiotic. So these all things helps the bacteria to develop defensive mechanisms, and it tries to protect itself and it develops resistance. So this is how the resistance is developing worldwide, and it is a global threat also. And this antibiotic resistance can develop in any age people. And because of this antibiotic resistance, what is happening? The dangerous infections or dangerous conditions are very difficult to treat, such as pneumonia, tuberculosis, gonorrhea, etc. So all these dangerous infections are becoming harder to treat because the antibiotics are becoming less effective. The bacteria is becoming resistant to the antibiotics. Now, why, as I told you, why is it occurring? Because of subtherapeutic dose. Now, if we take a you know, less doses, or we are just stopping the antibiotic abruptly and not finishing the entire course of the antibiotic. So, in such cases, what will happen? They completely do not kill the bacteria, or they do not inhibit the growth of bacteria completely. So, this allows the bacteria to perceive the chemicals that are present in the antibiotic and try to react to it and try to develop resistance to that antibiotics. So that is why, in order to stop the resistance, stop the developing of resistance, small steps can be taken to avoid such type of dangerous effects. So it is suggested to complete the entire prescribed antibiotic dosage, antibiotic regimen, rather than stopping it whenever we feel better. And because of this antibiotic resistance, what is happening? It is a burden on the hospital also. So prolonged hospital stays will be there, increased medical cost will be there, and increased mortality will be seen because of antibiotic resistance, because the patient is not getting treated very quickly and they have to stay in the hospital, the medical cost will increase, etc. Now, how is the bacteria doing all this? How is it able to become resistant to the drug? So, bacteria in and itself is developing certain mechanisms by which it is able to inhibit the antibiotic. It is able to fight against the drug. So, what are those mechanisms? Those mechanisms are, it will either cause an inactivation of the antibiotic. That means the bacteria will develop certain enzymes and that enzymes will inactivate the drug, or the bacteria will modify or protect the target site. That means if the antibiotic is going and acting on the DNA. If the target site of the antibiotic is DNA, then the bacteria, what does it do? It protects the DNA or it modifies the target site. Next is altered cell membrane permeability. What does it do? It will not allow the drug to enter inside, or it will develop certain pumps, if you can see in this picture, which will throw the antibiotic outside, efflux pumps. So as soon as the antibiotic enters inside, it will throw it outside. And the fourth one is active drug efflux. This is only the active drug efflux which I told you. It will have certain mechanisms or certain pumps developed which will throw the antibiotic outside. Then it will cause cell membrane permeability. It will not allow the drug to enter inside. Then even if the drug enters inside, it will either inactivate the drug by producing certain enzymes, or even if the drug enters inside, it will modify or protect the target site. So modifying means, see over here, it is making the cell membrane or the cell wall thicker so that the drug cannot act over here. So this is how the modification is developed. This is how the bacteria is trying to develop mechanisms in order to protect itself or in order to nullify the action of antibiotics. Among all the mechanisms, antibiotic inactivation is the most common mechanism. That means most of the antibiotic resistance is developed due to enzymatic inactivation. The bacteria is developing certain enzymes and the antibiotic is becoming inactivated. Now, what is the difference between resistance and tolerance? So we have already studied this in our first lecture about resistance and tolerance. So we will see in view of the antibiotics today. So resistant microorganisms, that means the resistant bacteria, they multiply in the presence of antibiotics. So they are so resistant that they are able to multiply in the presence of microorganisms. Tolerant microorganisms means they tolerate the antibiotic and then they start to grow as soon as the antibiotic is removed from the body. So if you see in this picture, this is the antibiotic and this is the target site. So as soon as the antibiotic binds to the target site, it will corrupt the target. Now this target can be anything. It can be the cell wall, it can be the cell membrane, it can be DNA, it can be ribosomes, it can be folic acid, anything. Folic acid synthesis, anything. So as soon as it binds the target, it corrupts the target and leads to cell death. Now, what is happening when there is resistance developed? Now, in resistance, what is happening? The antibiotic is trying to bind to the target, but the target is not getting corrupted. So, that means the target or the bacteria is becoming resistant to the antibiotic. So, antibiotic fails to bind. Why does it fail to bind? We have seen the mechanisms. Why does it fail to bind? Either due to enzymatic inactivation or protection of target site or drug efflux or cell membrane permeability. Because of these reasons, it is not able to bind to the target site. Then this is known as resistance. Tolerance means a different molecule inhibits the antibiotic target. So the bacteria becomes tolerant, but how does it become tolerant? It takes the help of another molecule, and this molecule inhibits the antibiotic target and it prevents the antibiotic from getting corrupted. This leads to the development of tolerance. So this is the difference between resistance and tolerance. Now we have seen about the antibiotics, what are the types, what are the mechanisms, etc. Then we have seen the problems of resistance. Then we have seen what is the basic mechanism by which the bacteria actually develops resistance. Now what can be done to prevent this resistance? How are we going to prevent the resistance? Or how are we going to control the antibiotic resistance? So many small steps can be taken in order to prevent or control the resistance. So small, and the entire society is responsible for doing this. It is not a one man's job. Each and every person is responsible to try to prevent and save the community. So as we all know that antibiotic resistance is maybe due to, most of the time it is due to misuse of antibiotics, overuse of antibiotics, or poor infection control procedures, poor infection prevention procedures, etc. So the entire community is responsible in order to prevent this antibiotic resistance. So first, coming to what are the duties of individual persons to control the antibiotic resistance. First and foremost thing is to use the antibiotics whenever they are prescribed. So not to self-medicate or medicate other people without the prescription, and never demand the antibiotics from the doctors. Also, preventing, following the preventive measures such as washing hands and being hygienically clean and preparing food hygienically, keeping vaccination, vaccinating ourselves, all these things helps to, in the first place, it helps to inhibit the bacterial infections. Okay, if the bacterial infection comes, then antibiotics should be used whenever they are prescribed. If they are not prescribed, then do not use the antibiotics. Now, when the antibiotics are prescribed, then it is necessary to follow the entire prescription. If it is a 3-day course or a 5-day course or a 7 days course, the complete antibiotic course has to be completed, and never share the leftover antibiotics. So even if you finish your course of antibiotics, there might be some medications left in the box. So do not medicate others, or do not self-prescribe it the second time, or do not take it by yourself and never give it to anybody else. That is the duty of individual person to prevent antibiotic resistance. Next, we will see what is the duty of the policy makers. It is the duty of the policy makers to educate the public as well as the healthcare providers. So they have to educate the people around them about the antibiotic resistance, and they have to develop good policy and procedures to tackle the antibiotic resistance. Also, these people are responsible for checking the number of cases of antibiotic resistance in different hospitals, and they should also regulate and promote appropriate use and disposal of the medications, and they should make the information available when they get the data from the hospitals about the antibiotic resistance and etc. They should make it available to know the dangerous effects of antibiotic resistance. Next is the healthcare professionals. What is the duty of healthcare professionals? Be it doctors, be it dentists, be it nurses, be it pharmacists, etc. So what is their role? So basically, first thing is, if you see the doctors, they themselves has to follow the hygienic procedures such as washing hands, sterilizing the instruments, and prescribing the antibiotics only when it is needed to avoid the misuse. And also, it is the duty of the healthcare professionals to report the cases of antibiotic resistance to the policymakers, so that the policymakers can see how many cases are there, and they can make the data available to know what are the dangerous effects of antibiotic misuse. And apart from that, it is the duty of the healthcare professionals to explain to the patients the dangerous effect of antibiotics. They should explain the patients the complete antibiotic regimen, how to take it, and how to complete the dose, and how important it is to complete the entire dose of antibiotics. So these all things has to be explained to the patients. And apart from that, the patients must be encouraged at the first place to prevent the infection by vaccinating themselves, washing hands, and following etiquette such as covering the nose and mouth when sneezing, etc. So we have seen the importance of all this during the pandemic, right? So this is the duty of the healthcare professionals. Next, we will see what is the duty of the people who are working in the agricultural sector. Now, why agricultural sector? What is the importance of these people in antibiotic resistance? Now, we all know that whether the dairy products are concerned, or whether the what do you say, non-veg things are concerned, etc. So in most of the cases the antibiotics are given to the animals in order to prevent infections in the animals. They are also given by prophylaxis, and the same thing is consumed by the humans. So apart from misusing the antibiotics, etc., unknowingly the humans are consuming antibiotic treated food. So in such cases also there are chances that they develop resistance. So it is the duty of the people who are working in the agricultural sector not to give antibiotics to the animals unless and until it is required. And do not use antibiotics or other hormone medications for growth promotion or prevention of diseases in healthy animals. So even if the animal is healthy, they try to give antibiotics to the animal as a prophylaxis so that the animal does not fall sick. So all these things are then consumed by the humans, and they should be they should be taught that the vaccination, how important it is to vaccinate the animals also. If vaccination is given to the animals from time to time, there will be no need of the use of antibiotics. And try to use the alternatives of antibiotics whenever they are available and whenever they are easy to use. So always it is necessary that the agricultural people, the people who are working in the agriculture sector, also promote and apply good practices in all the steps of production of the food, whether it is from animal source or whether it is from plant source, etc. So all these things and hygiene should be maintained in order to improve the, you know, what do you say, the foods coming from the animals and the plants. So all these people are responsible for preventing or controlling the antibiotic resistance, taken from the individuals to the policymakers, the healthcare professionals, and also the people who are working in the agricultural sector. So each and every, uh, the entire society is responsible for preventing the resistance. All of them have to work together in order to prevent and control the resistance of antibiotics. Next, we will see a small, brief, overview about antibiotic prophylaxis. Now, prophylaxis, you know that in such cases, antibiotics are prescribed prior to the bacterial infection, prior to the development of bacterial infection, right? So, prior to any surgery or prior to any dental procedure, mostly the doctors they prescribe antibiotics. Now, these antibiotics are prescribed for prophylaxis to prevent any major infection. So, they are basically used to prevent any post-surgical infection or to prevent metastasis of the bacteremias. So, in such conditions, antibiotic prophylaxis are prescribed. Now, in these conditions, as I told you, we do not know which bacteria might attack, which bacterial infection might develop. So, cephalosporins are preferred. These are broad spectrum antibiotics. So, they can cover a wide range of bacteria. So, cephalosporins are the most preferred drugs when compared to other antibiotics. Now, when should the patients be given prophylaxis? If the immunity of the patient is less, if the doctor sees that the patient is not very, that the immune system of the patient is not very well developed, or there is a chance that the patient might develop a infection during the time of recovery, post-surgical infection. So such type of patients, the patients who are, having other medical issues such as UTI or pneumonia or any other infection which might lead to the development of more infection. So in such type of patients, antibiotic prophylaxis can be given. So it basically depends on the doctor, how the doctor is able to see these patients. If the doctor senses that the patient is likely to develop a post-operative infection and that infection may have a serious hazard on the patient's recovery, then antibiotic prophylaxis is prescribed to the patient. And overall, if you see, antibiotic prophylaxis has been proven to be effective, which helps in quick recovery of the patient and helps to avoid the suffering of the patients with other bacterial infections. So this is about the introduction to antibiotics. So in this introduction we have seen about the different antibiotics, their mechanism of actions, and how are they acting, what are extracytoplasmic, intracytoplasmic, what is the spectrum of activity. Then we have seen how these antibiotics are misused, and due to this misuse how antibiotic resistance is developing. Then we have seen how this resistance can be prevented and controlled. Then we have seen a small overview about antibiotic prophylaxis. So this is about the introduction to antibiotics.